Erin Haynes is back with us. She is editor-at-large for the nonprofit newsroom, The 19th. And joining us now is Dr. Philip Aswa. He is the president and CEO of Montefiore Medicine, which is made up of 11 hospitals and over 200 outpatient facilities in the Bronx, Westchester, and Lower Hudson Valley. Dr. Aswa has an op-ed in the New York Times entitled, "I Fought Two Plagues and Only Beat One," in which he writes this: "As the head of a major hospital, I fought the coronavirus. As a black man, I fight racism. As the pandemic has subsided and our COVID-19 caseload has dropped to 143 patients from a peak of 2,208 on April 12th, the nation is coming to grips with another fearful crisis, the lethal effects of racism, the pain of which is all too familiar to me. It's hard to find comfort in this troubling time, but I see rare hope that these twin disasters disproportionately hurting minorities, one a brand new virus and the other a virus as old as the country itself, could finally prove the true strength of our shared humanity." Dr. Aswa, it's great to have you back with us again this morning. The last time you were here, we were talking very specifically about your hospital system's fight against coronavirus, but in your op-ed, you clearly and directly address what's been going on in this country for the last 2 weeks, and you use the word hope, I note, in your op-ed. What is it that you've seen in the streets of this country for the last 2 weeks that has given you that hope?
Thank you very much, Willie, and thanks for having me back on the show. What I've seen in the last 2 weeks is something that I believe is unprecedented in American history. Protests going on now for 15 straight days, hundreds of thousands of Americans. And what I see is a coming together to demand and to fight for the very idea and the very ideal of America, which is freedom and justice for all. And I see an unrelenting demand for those ideals and that idea.
Erin, you know, I got to Congress in 1995, have been on the air since 2003, and it seems like every time a crisis comes up, a race crisis, people talk about wanting to have a real conversation about race. And over time, I've learned to take those claims skeptically, because it seems that we never have that real conversation. I'm wondering if you're finding that in 2020, because of the gravity of the situation we find ourselves in, because of the number of protesters that actually gone out into the streets, and because there is more buy-in from white America, from Hispanic America, I wonder, are we starting to have that real conversation right now? And do you believe that we will actually make progress as a nation and move forward in a way that we didn't move forward in the past, after Charleston, after Trayvon, after Eric Gardner?
Well, you know, Joe, I think that we've had a lot of conversations about race in this country, and I think that a lot of Americans, especially Black Americans, are tired of talking and are ready for action, which is what you've been seeing really in these past several weeks. And what Dr. Aswa hits on in his very powerful op-ed is something that I've written about quite a bit, which is the pandemic within the pandemic, the dual ills of coronavirus and racism that have ravaged the Black community. You just referenced these unemployment numbers. Black Americans were already facing, with the coronavirus pandemic, the 1-2 punch from both a public health standpoint and an economic standpoint. And now, you know, to be confronted with inequality on full display across our society, including in terms of policing, really has just been a bridge too far for some folks. You see the cases of Breonna Taylor, the Louisville EMT who was literally trying to save lives in the coronavirus pandemic, only to be gunned down in her apartment by police serving a no-knock warrant on the wrong home. And then, as we know, George Floyd, who beat coronavirus in April, only to die under the knee of a Minneapolis police officer's neck. And so, you know, I think the question that Dr. Aswa raises in his op-ed and that I've been asking is, what if we approached systemic racism the way that we approached the coronavirus pandemic, right? I mean, we'd be asking questions like, what are the symptoms? How can you get it? is there a cure? What is that cure, and how do we get it to people, right? How much would it cost? And what is the federal government's responsibility to address this pandemic? Listen, I think we've seen the country's imagination around responding to coronavirus, and I think it remains to be seen what our imagination is going to be in confronting systemic racism. What we like to say a lot in talking about the coronavirus is that we're all in this together. But I think it remains to be seen if that is going to be the case around systemic racism. But as the country reopens and we reimagine what life is going to be like post-COVID, I think we also have to think about what the new normal is going to be around race relations in this country.
Doctor, respond to that, if you will.
Oh, I agree, Joe. I think that the coronavirus is novel and threatens us as individuals, and there's nothing novel about racism. It's been here since the beginning of the country, and it threatens us as a society. What we did in 4 months with coronavirus was put a whole lot of intellectual firepower and resources behind understanding it. We got to know who was affected by it. We understood that there was a spectrum. Some people had it and showed no symptoms. Some showed mild symptoms, and some showed severe symptoms. Well, it might be the same with racism. Some have it and it doesn't show until certain circumstances emerge. But I think if we apply the same selfless courage and determination that we apply to understanding coronavirus, and we marshal that same courage and conviction to understanding endemic racism, I believe that there is hope that we can finally rid ourselves of that virus as well.
Dr. Oswa, you write in your op-ed that your hospital system in New York City has hopefully seen the worst of coronavirus from those crisis days of March and April, where all the beds were full, there was no PPE, not enough PPE for your doctors and nurses. But we're seeing today more reporting of it popping up in other places across the country, Texas, Arizona, other places that didn't have the focus in those early days. As you look as a physician and as someone who is an expert on public health, what are your areas of concern as we now move into this long summer?
Right. I think, certainly when I look at the mass gatherings in the protests, as a public health official, that concerns me. I'm gladdened to see that most people are wearing a mask, but I would wish that all were wearing face coverings on both sides, on both protesters and law enforcement. So that worries me about a surge and transmission of infection. On the other hand, I understand why people are on the streets. And I think there's a long history of Americans putting themselves in harm's way to fight for and protect the ideals and the principles of America. So I understand the assumption of risk on the part of the protesters to fight for a change that they believe is a worthy cause. But I do worry about a resurgence of COVID-19, which, as was said earlier, disproportionately affects underserved communities and giving the representation amongst the protesters the conflation of those multiple dimensions worries me.
President and CEO of Montefiore Medicine, Dr. Philip Oswa, whose op-ed, powerful op-ed, is in the New York Times. You can read it online. Dr. Oswa, thank you again for your time this morning. We appreciate it. Coming up next on Morning Joe, voters have a choice this November, and the Lincoln Project says it is between Trump and America. Steve Schmidt joins us with the group's latest ad next on Morning Joe.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.